Hello everybody, my name is Dr. Herman. I'm the owner and CEO of Liberty Chiropractic and Wellness Center, and I've been practicing alternative medicine for the past 12 years. Today I want to show you some techniques on how to get rid of a tension headache in 5 to 10 minutes or less. Today I'm using my very dear patient, Michelle, and we're going to be going over some techniques that I use on a daily basis. First, I want to talk a little bit about headaches. There's numerous types of headaches. For example, there's migraine headaches, cluster headaches, tension headaches. There's a type of headache called cervicogenic headache, which is coming or originating from the neck, and many more. If you have a tension headache, these techniques that I'm going to show you should quickly and effectively get rid of it within a couple hours. So let's get started. The first thing that I would do is I'm going to do some massage techniques on Michelle's head and neck. So I'm going to feel the neck and head. For those of you who have more experience, you want to feel where it's tight and where there's tension. Or you could ask the person where they feel the tightness and tension, and you want to start there. So what I'm feeling is tightness in the neck muscles along here, and I'm feeling tightness in the temple muscles up here. That's actually called the temporalis muscle. And I'm also, which is very important with headaches, especially tension headaches, feeling a lot of tension in the scalp itself. So the first thing I'm going to do is I'm going to start by working on the neck. So I'm going to turn the person's head slightly this way, and with the tips of my fingers, I'm just going to do gentle circles. And it's important to not massage in front of the ear. You always have to go behind the ear, because in front of the ear there's arteries and there's the throat, and you definitely don't want to go there unless you're a trained professional. So I'm going to massage starting at the base of the neck and working my way up until I feel the hardness of her skull. And I'm going to do that, stay at the skull for a minute, maybe 30 seconds. Then I'm going to come back down and I'm going to work my way up again. Gentle, slow rotation. And always check in with the person to see if you're pressing too hard or not pressing hard enough. They will give you feedback. Then I'm going to take from the center of her skull, right at the edge of the bone, and I'm going to do circles and work my way from the back of her head all the way to just under her ear, which is called right in here, the occipital bone. So you're going to work under the ridge of the occipital bone 3 or 4 or 5 times, like so. One more time will be just fine. Okay. Next, I'm going to move the hair away a little bit because I want to work around the skull, around the ear. So you're going to use the ear as a guideline, and you're going to work all around the skull. So I'm going to start a little by the earlobe here, and I'm just doing circles with the 2 fingertips, first 2 fingers. Circles with medium pressure all the way around the ear to the top. Does that feel good?
Yes.
Okay. You might notice some ropey, bandy, hard muscles in there. Those are the ones you really want to focus on. It kind of feels like a thick guitar string. If you feel that, you want to spend some extra time there, maybe put a little extra pressure. So you do that 3 or 4 times around the ear. Good. Now, of course, you're going to do the same thing on the other side. But for the sake of time, I'm not going to do that. Then you want to work the muscles in the forehead. There's actually little flat muscle underneath the skin here. So you take your thumbs and you start right at where the inside of where the eyebrows start, and you slide with medium pressure your thumbs all the way out until you get to the temples. And then when you get to the temples, you want to do circles. 1, 2, 3, 4, 5, or 6. Then you're going to start up again a little bit higher on the forehead. And you're going to stretch, 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 pressure, 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 and slide all the way down to the temples. Once you get to the temples, you're going to do circles, what's called the temporalis muscle. Good. You're going to come up a little bit further, and you're going to keep doing this until you reach the hairline. Come down to the temples, and circle, circle, circle. How's that feel?
Good.
Good. Then you're going to do an acupressure point, which is, if you run your finger along the ridge, the bone of her upper eye socket, you should feel a little notch just to the side of the nose. And that's a pressure point from acupressure. So you're going to push your fingers in with medium pressure, of course, always consulting with the patient or your friend or family member to see if it's too much pressure. Is that too much pressure?
No.
And you're going to just put pressure there, about medium pressure, and hold it there for about 30 seconds. Okay, for sake of video, I'm going to go less than 30 seconds, but I would do about 30 seconds there. Okay? Now what you want to do is you want to actually massage the ears. The ears, if you've heard of reflexology, have a lot of acupressure and acupuncture points in them. And you want to just squeeze, kind of medium pressure, and pull the ear out a little bit, all the way from the earlobe up to the top. Some people might be sensitive there, some people love it. If they're sensitive, you might want to go less pressure or maybe even avoid doing this, but I'm telling you, most people are going to say, oh my God, that's the best thing I've felt in a while. How's that feel?
Good, very relaxing.
And it really helps to get rid of the tension, and you're also working acupuncture points, just like you would if you had a reflexology session on your feet. And if Elaine, if you can zoom in, you can notice that the ear is getting red, and that's a good thing. That means more blood is starting to flow into the area.